A very good day to all of you. We are from Group B3 and today we are going to discuss about mental health. Before we start our discussion, let me introduce my group member first. Myself, my name is Tan Eng An. I am the group leader of this group and my group member, Faris, Shake, Sharvish, Jason, Wenchi, Joshuan, Jackie. Nowadays, mental health problem has increased in Malaysians, and around 30% of Malaysians have been suffered from this problem. And the research found that around 1,080 persons had already committed suicide due to these mental health problems. Okay, what is actually mental health? Mental health actually is a state of mental well-being that enable people to cope with stress and also to contribute to their community. It also refers to their behavior and also emotional. But sometimes people use the term of mental health to mention the absence of mental disorder. From my observation, people who do suffer from mental health problems will show some various of symptoms such as no energy, eating disorder, sleeping disorder, and also easy to be angry. And in my opinion, I think mental health problem is quite important in our life and every stage of life, such as childhood, adulthood, adolescence, and also young people. So that's mean every people in this world will have the chance to suffer from mental health problem. Okay, so what do you guys think?
Okay, I have an idea about the factor poor mental health. Okay, I think one of the biggest factor that lead to poor mental health is drug abuse and excessive alcohol consumption. Regular cannabis use can increase your risk of anxiety or depression. There are also a link between using stronger cannabis and developing psychosis or schizophrenia. Stimulant and drugs can make you feel depressed, anxious, and paranoid. Cocaine, a type of a stimulant, it can make previous mental health problem recur and trigger psychosis and schizophrenia. Ecstasy, user can experience memory problems. Mixing it with alcohol or drug can be dangerous or even fatal if you take medication. You may feel you are no longer in a control of your drug use or need to take more of it to feel an effect. If so, you could be becoming addicted. Drug addiction is linked to mental health problems. In 2020, were around 19.7 thousand males in Malaysia who had at least one recorded drug offence in that year compared to 974 females. This was despite the harsh law in the past regarding drug consumption and possession, and it's so worrying because statistics from KKM, Kementerian Kesihatan Malaysia, will show us that many people who take drugs for the purpose of entertainment or whiling end up that lead to poor mental health. Furthermore, neglection such as racism also will encourage a mental health issue because racism causes trauma, and a trauma paints a direct line to mental illness, which need to be taken seriously. Many species of racism, for example, racial profiling, poverty, disabled, and a weakness. From this point, actually, racism will make us exhausted because we will always feel unwelcome, lonely, or isolated, especially if a people organization have said or implied that you don't belong. Don't forget, either racism will make us easy to angry or frustrated, particularly if you are being treated unfairly and if you feel powerless to control it. So it shows that neglection will also contribute to lead a mental health.
I agree with you. There are numerous potential causes for the mental health issues. Although various people may be more severely impacted by specific things than others, it's likely that many people are affected by a complex combination of circumstances. Living through a traumatic situation might leave you with a lingering emotional reaction that we call trauma. So you could feel uncertain about caring for yourself and managing your moods or emotion after going through this situation. There are many different forms of traumatic occurrence that we can witness in both in our work or our own country, such as child abuse. they may be afraid of their security. By seeing how children behave emotionally and physically, that we can identify that it could be that they have trouble with falling when they asleep, or they cannot sleep in the dark or with the light on alone. My next point is crop out from our country's socio-economic situation. If our country's socio-economic rise and fall, this has a very negative impact to ourselves. The factor that influence is include war or fight between other countries that produce the main raw material, or our country's unstable political status. For example, a situation that can or has occurred is when our country's main raw material such as rice, eggs or flour are in short supply. As a result, the seller will either raise the price for customer, or they will ration our quantity available.
I think we all must agree to what both of them have said. The factors that they have mentioned actually contributes to the occurrence of mental health among Malaysians. So I think, in fact, I do have some examples of the real cases happen in Malaysia. According to statistics, there were 1,081 suicidal attempts were recorded in the year 2020. These are only attempts. The sad part belongs to the cases. The difference between the attempts and the cases are, attempts are just the trials of suicide, whereas the cases are the success of suicidal attempts. So according to statistics also, in the year of 2021, there were 1,141 suicidal cases were reported. It's actually a huge spike compared to the previous year, 2020, where the number was only 641. The huge spike was about 81%. We here actually can compare the occurrence of mental health with using the suicidal rate, because suicidal rate and depression rate are actually interconnected. So when there is a slight change in depression rate, there will be a slight change also in the suicidal rate. So through this, we can actually use suicidal rate to compare or to measure the occurrence of mental health in among Malaysians. According to the Ministry of Health of Malaysia, the huge 81% of spike were actually the result of severe depression caused by several factors such as chronic stress, loss of income, domestic violence, and is also the financial crisis, and also the unexpected losses of life during COVID-19 pandemic.
Through the tragedy of COVID-19 pandemic, we can see the Ministry of Health has been take action, asking for higher budget for mental health services, increasing from 11% to 13.5%. From the budget, they are distributing 6.2 million to 52 NGO for mental health services, further strengthening the country mental health and psychosocial support services. The former Minister of Health, Khairi Jamaluddin, has said that the responsibility of dealing mental health in Malaysia has to be borne by all, which is from the government, private sector, and also mental health NGO services.
Under the 7th Malaysia Plan in 1997, the mental health unit was set up under the non-communicable diseases section. It is responsible for the development and coordination of the community mental health program. The scope of the mental health program includes promotion of mental health, prevention and early detection through screening for mental health problems, treatment at primary health care, and psychosocial rehabilitation. The program and services that have been developed included Healthy Mind program in school, mental health and psychosocial response during disaster, Healthy Mind services in primary care, and stress at workplace program. In terms of psychiatric and mental health service, Malaysia has moved toward treating psychiatric service users in community-based care, especially in their own homes, supported by their family and the community. There are psychosocial programs in community clinics to provide the opportunity for people who have mental illness and their relatives to achieve a quality of life through their own environment.
Government has strategies in coping mental health problems in Malaysia. First, to strengthen mental health resource, government has built the knowledge and skills of general and specialized health workers, equip teachers with appropriate knowledge, attitude and skills on mental well-being, and expand counseling services by increasing the number of clinical psychologists. While to strengthen mental health surveillance systems, information system has to be strengthened through surveillance and monitoring. Researchers on mental health should be conducted to develop a database for data collection on several main mental health problems such as depression, generalized anxiety disorder, schizophrenia, and bipolar. Next, government also has the role to ensure the availability and accessibility of comprehensive and quality mental health services by strengthening mental health services through primary, secondary, and tertiary healthcare, and improving the access to community-based mental health services, which at least one health office or primary healthcare clinics having counselors providing counseling services per district. Lastly, government has also established and nurtured intra- and inter-sectoral collaboration. For example, government has put in efforts in educating non-MOH agencies on psychological first aid (PFA) and including mental health topics in school curriculum and core curriculum to cope mental health problems in our country.
So let me recap what we are discussing about. First and foremost, tongue and an introduction is quite detailed for us to comprehend the presence of mental health issue in Malaysia. Next, I also agree with Faris and Nur Shakir about their point on causes of poor mental health. Based on their point, I believe that each individual should be aware of such element, as it will jeopardize their mental health without their knowledge. Then, a real-life cases discussed by Jason and Sarvesh demonstrate that mental health issue in Malaysia is far worse than you would imagine. Jason and Sarvesh also demonstrate the action taken to settle those issues, which is financial assistance. However, this assistance is just temporary. Furthermore, Wenji and Joshua also emphasize Malaysia government involvement and list of mental health programs as a requirement made by the government to encourage good mental health practice. In conclusion, our emotional well-being and job performance and relationship are all affected by our mental health. When our mind are disrupted, it affects the total operation of the body. Therefore, I think that Malaysia community and society must raise awareness so that the afflicted individual do not feel compelled to end their lives.